on television, on with models and actresses. Now that leads to a very distorted sense of body image. How then ideal body should be, it has gone and undergone a sea change from what it was 50 years ago to now what it is now. And third, of course, the raging issue of depression. Now, depression, as I said, is a clinical illness, and it happens in about 15 to 20% of young girls. It is the most common mental health issue in women. The common symptoms of depression, how you can recognize that someone or yourself are undergoing depressive symptoms. There are significant changes in sleep habits. So if you were sleeping 6 to 8 hours of regular sleep earlier, now you are waking up 1 or 2 hours earlier than your usual waking up time. Major changes in eating habits. There could be a loss of appetite. There could also be an increased appetite. So uh, that those changes can occur in your eating habits. Also, if eating disorders now come into the picture, which I'll discuss a bit later on. There could be a total loss of enjoyment and activities that used to bring pleasure. This symptom is known as Anidonia. So a young girl or a woman who used to enjoy her activities like chatting with her girlfriends or going out and eating out, or maybe a hobby that she used to pursue, she no longer finds enjoyment in those activities. There could be rapid mood swings from day to day, or even within a single day. So she could be reacting to minor provocations, and her reactions might be too much for somebody to handle. There could be thoughts of suicide and self-harm. Self-harm is a very important issue that needs to be addressed in young girls and young women. And I, as a psychiatrist, almost see 2 to 3 cases of young girls or women harming themselves in some way. The the self-harm behavior might not be uh, very lethal, or might not be very injurious, but nonetheless, these are important markers of significant things to come. Now, factors contributing include weight issues, as I already stressed, the false body image that we are grappling with, problems with friendships, bullying. Now, relationships also come into the picture during this age, and relationships issues are, I think, top of the list of any young girl or a young woman. So, academic problems, sexual or physical abuse that a child, young girl, or maybe a young woman might undergo. So, these are the factors which contribute in the development of depression in women. Anxiety disorders. Now, unfortunately, women are twice as likely to get some or the other kind of anxiety disorder as compared to men. Men have different set of mental health issues, but depression and anxiety are two disorders which are much more common. In fact, 2 or 3 times more common in women as compared to men. Now, there could be several types of anxiety. One could be a very recognizable panic attack, where there is an intense fear or intense fearfulness from unknown factors. So the panic attack can develop anytime, anywhere, in any situation, and it almost feels like that something very bad is going to happen. But the important thing to note for anybody who's undergoing a panic attack, that it's self-limiting. So within 10 to 15 minutes, it's likely to die down. Other common anxiety disorders are generalized anxiety disorder, which is characterized by excessive worrying about everyday issues. Like, for example, my kid has not come from school at on time. He is 15 minutes late. God knows what might happen to him. Or my husband is having an affair with somebody because he is not answering my call from office for the last 2 days. So these are excessive worrying. These factors might come in everybody's life, but the important thing to note is the excessive worrying, which is disabling also. And another type of anxiety disorder is phobias. Phobias of common things like dogs or heights, or maybe places where you think you cannot escape from, like crowded places, or maybe a lift or staircases. So these are phobias of specific situations or specific objects. Another anxiety disorder is OCD. I think Most of us know about OCD due to its representation in the media. OCD is repetitive thoughts of maybe, for example, contamination, that your hands are contaminated with fecal matter or something very, very dirty, and you wish to wash them or wash your clothes all the time. Or there could be an obsession or OCD about placing things in a symmetry. Things are just not right. So you are spending most of your time ordering things or making things in order. So that is an important type of OCD in young girls who are preparing for examinations. So the common presentation of any anxiety disorder is feeling physically ill, like an upset stomach, nausea, or frequent headaches, worrying about things that are outside of their control, poor sleeping habits, including sleeping too much or too little, and pointing to vague symptoms to stay home from school. So missing school or missing work due to anxiety problem could be a red flag in such women. Now, eating disorders, this is an important factor to consider, or important problem of the new age, especially with the advent of the social media. The social media scene has exploded in the last 10 years. And those social media, especially Instagram or Snapchat, where the exchange of pictorial material or videos is happening, that leads to a distorted body image. So if you're seeing your favorite, if you're following somebody on Instagram and you're seeing her doing exercises and diets and losing weight all the time and talking about weight issues, so you are likely to believe, and you're subconsciously likely to believe that is the right way to live, or that is the right body image, and how I should attain that body image. And it leads to a lot of dissatisfaction, a vicious cycle of dieting, ritualistic food habits, very intense food habits or food rituals, and but the result is not there always, because that body image is actually not real. So every individual is tailored in a very specific or unique way. You cannot have a body structure or body size of another individual, no matter how hard you try. So eating disorders like anorexia nervosa, bulimia nervosa, or binge eating disorders. These are the three major type of eating disorders: anorexia nervosa, bulimia nervosa, and binge eating disorder. Of these, anorexia is the most harmful one because it leads to a almost persistent dissatisfaction with the body weight, and which causes the young girl to diet excessively and avoid food, avoid all kinds of food. I have had patients who have lost 30 to 40 kgs from down from 60 kg in the last 1 year. And the girl is almost unrecognizable now when she presents to the OPD or the presents to the doctor. And losing so much weight and having the dietary practices that one is following can be harmful to the metabolism of the body. So majority of the individuals with anorexia and bulimia, teenage girls and young women, unrealistic beauty standards and a focus on body weight is significantly impact the body's ability to get nutrition, very important, and can harm the heart, major organs, bones and teeth, and lead to other diseases. Now this there in our culture, there was a study that I came across which was carried out in India, which said that which concluded that excessive fasting that we see in Indian women is also a kind of eating disorder. So eating disorders can present in different individuals in a different setting, or in various cultural settings it can present differently. Next is ADHD. It is an attention deficit hyperactivity disorder. This disorder has been most talked about in boys because it's more diagnosed in boys, young boys, but it's very common in girls also. It's just the hyperactivity component which is not present in girls. So it goes unrecognized, and it is a young girl has to struggle with this disorder throughout her life. It leads to attention dysregulation, means you cannot sustain your attention at one place or at one task for even a small amount of time. There is impulsivity, impulsive outbursts, or impulsive speaking, excessive speaking, and sometimes hyperactivity. There could be problems with time management, organization, decision making, working memory. planning, emotional regulation, and prioritization. How do you prioritize your tasks? How you organize any complex task? So it could be difficult for anyone who's studying to crack an entrance exam, or somebody who has just joined a new company or a corporate firm. Uh, Working in such an organization requires you to plan and make decisions all the time, and ADHD does not let you do that. So recognizing ADHD in young girls is very important. Now we come to the menstrual related problems that we see in women. I think no problem has been stigmatized as much as premenstrual syndrome in women. The feminism movement disregarded this syndrome, that it's just a creation of men, and it actually does not happen. But now the evidence is very strong. The medical science has advanced to find out that it's a biological disorder where there is a change in mood and behavioral symptoms just prior to the menses, when the menses occur at the 28th day of the menstrual cycle. So it is usually seen in the week preceding the onset of menses, and it can be diagnosed if the patient reports at least one of the following: affective means mood symptoms, and somatic means bodily symptoms before menses in each of the three previous menstrual cycles. So the important thing is that they should occur in consecutive cycles or happening persistently. The mood symptoms that are present in pre-PMS are angry outbursts, anxiety, confusion, depressive symptoms, irritability, and social withdrawal. Every individual can present with some of these symptoms. One Any individual who is having PMS. Then there are bodily symptoms like abdominal bloating, breast tenderness or swelling, headache, joint or muscle pain, swelling in the extremities, and weight gain. So it can lead to a lot of dissatisfaction and irritability in any woman who experiences these bodily symptoms. A severe form of PMS is premenstrual dysphoric disorder, which is characterized by more mood symptoms. So the mood can be excessive anger or rage or irritability. So those symptoms dominate rather than the bodily symptoms. So PMDD is just a severe form of PMS or premenstrual syndrome. So PMDD is a severe negative reaction to the natural rise and fall of estrogen and progesterone. Sufferers of PMDD report damaging and impulsive behaviors that may include suddenly leaving a job or a relationship. So PMDD can be so disabling that it can harm your job prospects or even your relationships. If somebody is suffering from PMDD and is not aware of that, uh, she she may she may be showing excessive reactions, and which may lead to consequences which she did not want at all. The important thing to note is, although estrogen and progesterone levels vary in almost every woman, it's the sensitivity of the brain to these hormones that is responsible for PMS or PMDD symptoms. So how your brain reacts to these changing level of these hormones, that determines whether you have PMS or not. Now, treatment options in PMDD. I think I'll just briefly recommend one thing. If somebody experiences PMS or some such mood symptoms before her menses, then she can take calcium and vitamin D supplement. Um, this has been replicated in various studies that calcium and vitamin D supplements actually help in reducing PMS. Otherwise, if you're not getting help, you should go to a professional like a psychiatrist or a psychologist for seeking help in PMDD or PMS. There are a number of options, and all of these are helpful in reducing the symptoms. Now, pregnancy related mental health problems. This is a very important and a very large topic, and I would like our colleague on the panel, Dr. Anunit, to take um, the pregnancy related mental health problems. I would be just briefly telling you about what is perinatal mental health, and there are actually three major group of disorders or symptoms. One is postpartum blues, second is postpartum depression, and third is postpartum psychosis. Dr. Anunit Sabarwal would be taking these in detail and how you can manage these symptoms after pregnancy. Then is menopause. Dr. Anunit, I'll just be ending in a minute, then you can take over. Menopausal
Sure.
symptoms are well known across the board. Post-menopausal syndrome, it is due to shift in hormones toward the end of reproductive years, usually occur between 40 to 48 years in most women. Mental health symptoms may be reignited in those prone to them. So if you have had a depressive episode earlier in your life, menopause is the time when it can reoccur or relapse. Other midlife stressors are also present in this time, like caring for both children and parents. It's actually a midlife crisis of the women. So while she is undergoing menopause, the added responsibility of caring for old parents as well as children who are growing up and are in very crucial stage of their careers. So postmenopausal syndrome can be characterized by mood symptoms like anxiety, depression, hot flashes, and excessive sweating, sleep disruptions, and decreased sexual desire, of course. Then there could be changes in the urinary tract or even the urogenital system, like vaginal dryness or itching. Urinary frequency might increase, but there is hope at the end of the tunnel that postmenopausal syndrome can now be treated quite quite successfully. So the women do not have to lose heart here that you'd be soon turning 45 and have to grapple with postmenopausal syndrome. Now, some disorders which are common to both men and women, but in these disorders present differently in women, like for example, substance use disorders. Now, substance use meaning taking of any drugs or alcohol or any other banned substances. So, the important thing to consider here is women actually have a more chance if they start taking alcohol or maybe weed or even smoking, that they will going dependent on it. Men get dependent later on. It's due to the biology. It's the how you metabolize alcohol that is different in men and women. That women have much more toxic effects of alcohol as compared to men. Men can tolerate a much larger quantity of alcohol because of an enzyme that is present in the liver, which is actually not present in sufficient quantities in women's liver. So uh, we see more toxic effects of alcohol and other drugs in women. Then, to end the disorders, I would like to just stress upon the gender stereotyping performance. I think most of you have been women who have been working somewhere, are career women who are working in a corporate setup or maybe self-employed. So gender stereotyping, especially in areas which are dominated by males. For example, a woman who is going to uh, become an IPS officer or going to be a police officer or maybe in the army or joining an engineering division or maybe a corporate firm where there are more men, much more men than women. They react differently to the situations. They have to actually struggle with the gender stereotypes that is prevalent in the organization and also have to perform up to the level that is expected of them. So it may she may be unable to fully attend to tasks because part of her brain is occupied with monitoring her performance and social acceptance. So the brain capacity is limited. If you focus your energies towards fulfilling your gender roles and gaining social acceptance in an organization, your efficiency goes down. So the women have to struggle with the gender stereotyping, and fortunately or unfortunately, men do not have to struggle so much regarding gender stereotypes. A woman may work harder to compensate for these cognitive and emotional demands, but can burn out. A woman may also feel pressure to underperform in order to conform with others' genders expectations. So, a woman who is actually a torch bearer or scorching the corporate ladder and going to the top is is uh, is the also the object of envy of her colleagues, male colleagues as well as female colleagues, and she has to sometimes underperform to gain social acceptance. This is very important, and men cannot even fathom what women have to undergo or struggle to reach the top of the corporate ladder in such organizations. So gender stereotyping is important mental health issue, important factor that leads to mental health issues. At the end, I would like to summarize that women are at particular risk for specific mental health disorders throughout their lifetime. Many disorders are missed or misdiagnosed due to differing presentations in men and women. greater awareness and accessibility to mental health resources is the need of the hour. And this webinar today, I think this fulfills this need quite well. And if there are women who are grappling with these issues, I think this is the right platform to voice those issues. Thank you. And I request my co-panelist, Dr. Anuni, to take over, please.
Thank you, Dr. Manushree. That was a lovely talk by you. So basically, I'm going to be talking about issues during pregnancy, right? Just give me 1 second. I'll share my presentation with you. Are you able to see my presentation?
Yes, sir.
Yep. Give me 1 second, please. Yeah. So a little bit about me. I'm Dr. Anunit Sabarwal. I'm the founder and director of the Happy Tree. We are a de-addiction and mental health hospital. We're also one of the fastest growing chains of rehab centers in India. So we're located in New Delhi. We're headquartered in New Delhi, and we started our operations in 2016. We've completed about 7 years in the business now, and it's a wonderful journey till now. So I'm going to be talking about mental health and pregnancy. To introduce you to the concept of mental health issues and pregnancy, it can essentially be, there's an overlap. So it could either be the person could, either be someone who's already been diagnosed as having a psychiatric illness and then becomes pregnant, or it could be someone who's become pregnant and then gets diagnosed with, a psychiatric disorder. So in the first instance, of course, we focus on, preventing further episodes of either mood or psychotic symptoms. In the second instance, when we're able to predict that something related to a psychiatric illness may happen, we focus on management. So just looking at the umbrella picture of what kind of mental disorders a person who's going through pregnancy may experience. So it's under the umbrella you have anxiety disorders, psychotic disorders, personality, dissociative, substance use, eating, mood disorders, and issues with self-harm. I think most of these have already been discussed in detail by Dr. Manushree, so I'm going to be focusing on the theme more. Now, these are the stats, and they're stats that one must take into account. The most risky time to become mentally unwell for a woman is after having a baby. So you have 10% to 15% of women who suffer from depression after having a baby, 10% of pregnant women who suffer from depression, 15 to 20% of women suffer from anxiety during and after pregnancy. 1 to 2% of women suffer from bipolar disorder during and after pregnancy, and about 0.5% of women suffer from postpartum psychosis. So you've already been we already know about depression and anxiety, what they are. Bipolar disorder is a kind of disorder that has mood symptoms on opposite poles. So on the one pole you have depression, and on the other pole you have mania or excessive mood elevation, where it becomes inappropriate and socially hampering, occupationally hampering for that individual. To put it very simply, a psychotic episode is one where you simply lose touch with what reality is. And that's about 0.5% of women who suffer from postpartum psychosis, or psychosis that happens after having a baby. So if we were to look at postpartum depression and why that happens, and look the contextual factors in India, the first and foremost thing that India is still struggling to come to terms with is the stigma and unhappiness over having a female child. Now, infanticide is a big problem in India, and unfortunately, because of this cultural grooming, a lot of women are become extremely unhappy, and they have extreme anxiety over bearing and producing a female child. Then, of course, there could be oppressive relationships with their in-laws or the partner. This has certainly improved in the last 2 decades, but it is still a major issue. Of course, women who are not working have a lot of issues with the lack of having control over the financial decisions and family planning. And this is my take on what a contextual factor that may be affecting a person's mood is, of course, rape within marriage, which is actually legal in India. There are conflicting views on whether it should be. So intimate partner violence and non-consensual sex within marriage. So, what are the signs, signs and triggers of pregnancy and depression? So, women are 2 times more likely than men to suffer from depression. That's one of the most important statistics that we must know. The signs and symptoms, we've already been talking about them, but when we refer to pregnancy, they're essentially centered around having a child and how to deal with having a child. Essentially, the theme is very specific to having a child and having to deal with them, right? The other symptoms, signs and symptoms of depression are, persistent sadness, difficulty concentrating, loss of interest, etc., etc. Now, the triggers, we've already talked about the contextual factors. So, of course, there could be other possible triggers as well. So, young pregnancy, this is a particular problem in USA where teen pregnancy has been at a historic high. There could be other issues now as in India, as people have become more developed, more educated, people have started marrying late. So infertility has become a major problem with us, right? Now, the other thing is with the cultural shift in India as well, we've switched from joint families to nuclear families. And so life has certainly become a lot more lonely than it was 2-3 decades back. So that is another trigger that may affect, especially when you know that there's essentially just you who's taking care of the baby and very few people who are there to lend you support. Now, there's a marked distinction between what baby blues is and what postpartum depression is. So you must understand that even with depression, it can be either physiological, which means that you expect it as a normal human response, or it could be a pathological one, which is certainly part of a psychiatric illness. So baby blues, or just feeling a little bit of sadness and feeling low, that happens in up to 80% of new mothers. And so if you're feeling sad, you're not alone. There's a lot more women who are feeling low and sad and anxious about what's to come. Generally with baby blues, however, the symptoms will not exceed 2 weeks. They'll come for a couple of weeks, you cry a bit, you'll have mood swings, anxiety, etc. But they generally resolve within 2 to 4 weeks. When we talk about postpartum depression, that is a much more pathological, serious condition where symptoms can begin immediately, but they can continue up to 1 year of having had the child. So symptoms we've already discussed. Of course, this postpartum depression needs to be treated, otherwise it doesn't go away. Baby blues resolves on its own, right? And when we talk about anxiety, there's of course the general symptoms of anxiety are common. They're also experienced during pregnancy. So you can have shaking, sweating, cold chills, headaches, nausea, dizziness, restless chest pain, bloating, feeling like you've lost your memory, stabbing pains in your chest, weakness in your limbs, feeling of fatigue long when you start urinating very frequently, etc., etc. So these are all symptoms of anxiety that one may experience when having a postpartum anxiety episode. So generally in the perinatal period, we have this is a very basic classification of what a person may go through. So one's generalized anxiety disorder, which basically means that the anxiety is all day, all the time, paralyzing, right? Panic disorder is what the word basically means. You have panic attacks, that is pangs of anxiety that become uncontrollable and they really take you to task. Phobias, well, some people develop an unnatural fear of something which does not generally elicit a phobic response. And OCD is your thoughts will completely dominating your life. You're not able to get away from them, and you have to perform certain rituals to get to deal with them. And postpartum post-traumatic stress disorder, which basically means if you've gone through a trauma, it could be a stillbirth, it could be being reprimanded by the in-laws for bearing a girl, etc., etc. So these are all post-traumatic stress disorder symptoms that may happen postpartum. I've already discussed what these anxiety types of anxiety disorders basically mean. So we'll look at postpartum. So we're also going to look at postpartum psychosis. Now that's 0.5% of the population. Generally, that's the statistics that we go for based on all the studies that we have. Now, psychosis basically means losing touch with reality, right? Now you have either delusions or hallucinations. A delusion is a belief which is not true. And even though it's not true, and even though you've been told, you've been asked, the belief has been challenged by an interviewer, you refuse to believe that it's not true. You still believe that that's true. For instance, you may believe with certainty that your spouse is having an affair, even though he may not. But still, if you continue to believe it, despite being challenged, that becomes a delusion. A hallucination is a sensory experience which is out of what a normal human being can experience. So this could be seeing things, hearing things, feeling things, smelling things, tasting things, etc. Disorganization of behavior means you're basically just your behavior is all over the place, right? There's no determining tendency. There's no kind of straight line tendency to kind of go and do a specific activity anymore. Your behaviors, it could range from hoarding things, to shouting at people, to completely being completely perplexed, etc. Right? Low insight is basically you having knowledge that you have an issue that you're dealing with. For instance, if you have, let's say, cancer, you know you have cancer and you know what to do about it. In a psychotic illness, you don't understand that you have a psychotic illness and you refuse to have it treated, right? Now, sometimes postpartum psychosis can be very severe. The reason for that is, there's risk to the baby. Some women with postpartum psychosis have issues with having, of course, delusions against the baby as well, so they are at risk of harming the baby physically. There have been instances where I've seen patients who've actually tried to throw the baby off the balcony of the house, and so that in such cases one does require hospitalization. The question is whether you want to take meds or whether you don't want to take meds. This is both from a doctor's perspective and from a person who's suffering from it perspective, right? Now, from a doctor's perspective, generally SSRIs and TCAs are the safest, very safe in pregnancy and breastfeeding. One would tend to go avoid lithium, valproate, and other mood stabilizers. And in my personal opinion on this is that ECT is by far, I would say, the most effective in patients who are going through postpartum psychosis. Now, if you're lactating, if you have a baby and you're feeding them your milk, you have to, as a doctor, the general rules are that I must kind of discuss with the patient, what the risks are, what the benefits are, and what are the possible effects the drug might, if I'm prescribing them a medicine, what are the possible effects the medicine might have on the baby? Should it be passed on through the milk? However, in my practice, I always go for the non-pharmacological interventions first, unless it is extremely severe. And the reason for that is I'm a very strong believer that counseling or psychotherapy really works. My other very strong belief is that breastfeeding is one should never discourage breastfeeding. Top feeding is a very easy, convenient option, but breastfeeding is the best for any baby. So as far as medications are concerned, if the person has already been on psychiatric medications, the ideal way is to basically stop all meds and go for just one medication. Go for the minimum dose of that one medication, whether that's an antipsychotic or an antidepressant. Switch to one and just stay with the lowest possible dose. And one must also understand that if you have a pattern of kind of lactating and you have a pattern of when you're going to feed your baby, it's always best to take your medicine 8 hours before you take out your milk the next time, and then express a few drops, a few ml of milk, so that the exposure of the baby to that medication is minimal, right? Most importantly, physical self-care is very, very effective, and I very strongly recommend it. So exercise, do yoga if you can, eat healthy, don't drink alcohol, I'd say, but if you must, drink your alcohol in moderation. Don't skip your multivitamins, don't skip your appointments with your gynecologist. And sexual behavior should be regular and as per your health at that particular point in time, right? As far as your mental health care is concerned, well, you must understand, you must learn to switch off once in a while. Sometimes get in your own bubble, take a nap. Sometimes just go outside, smell the roses, see a movie, call a friend, talk to someone, talk to your near and dear ones, and just relax. So that's about it from my side. I think I'll hand it over to the moderators for the next segment.
Thank you, Dr. Anuneet. So next up, Nikita, please.
Yes, thank you. Thank you, Dr. Adit, for such a wonderful introduction. Thank you, Dr. Anuneet, for explaining the life of how a woman is in terms of pregnancy, postpartum. Thank you. Thank you for all of that. Thank you, Dr. Manishri, for sharing about women's mental health during a lifetime. Just allow me a second before I share my screen. Just a second. Okay, some technical glitch here. It's not coming. Is my screen visible?
Yes, yes, it is.
All right. Thank you. All right. Moving ahead, just because it was time for, it was during the COVID times where everybody was working from home, women had faced a lot of stress, anxiety, which mostly Dr. Anuneet and Dr. Manushri, they've captured it all, they've explained it beautifully. However, while working in the corporates, while working with people who are in corporates, this had been a journey for every woman who has faced a difficulty while they were working at workplaces, and now they're going to be returning to home. They're going to be returning to their offices. There was a life which was during the pandemic, which was work from home. When they were working from home, there were a number of challenges, there were a number of difficulties that they faced. Eventually, they got used to it. The initial periods were quite difficult, sitting back at home with the child at home, online classes happening, elder people at home. Managing all of that became very difficult. Now, moving ahead, this is what the statistics show. Millions of women, due to all of this, due to all of the stress that took place, they left their workplaces. The bars that we see in red represent women, and the bars that we see in gray represent men. India, amongst all, was the top. 24% of women left their workforces. And when we see towards the West, 13% in Canada and 18% in US, 17% in Brazil. This is what the women workforce was, and this is how the pandemic hit, and they had to leave their workplaces because of many reasons. Let's explore what could be the possible ones. Women's working mothers, they had to cut back their hours substantially due to hours of unequal share of caregiving, because they were the ones who were taking care of the domestic work, house cleaning, cooking, etc. All the household responsibilities landed onto them. Children at home, plus husbands at home, and then the elderly is at home. It was very taxing. Over a third, so that means 33% of women left their jobs during the pandemic and have not returned so far. 25% of women in the corporate world are considering to go in for a low-key role. So if they were at a higher position, they're okay taking up a low-key role in terms of balancing their house and balancing their work. 42% of women said that they felt burnout in 2021 compared to with 32% who said so in 2020. That means it has gone up 10% high. What could these pressures be? Where are these pressures coming from? COVID forced many women to shift their priorities to take care of children or older relatives. Highly ambitious women who were very career oriented had to take a step back. They were not able to work because of the other priorities. Many women assumed the role of teachers. So they had to wear a hat of being a teacher, because at home, everybody, all the responsibilities, everything landed onto them, whereas in considering the online classes of children too. Violence against women increased. Men had never been at home. The businesses were not going well. There was a financial crunch. And all of a sudden, when all of these things came together, this amalgamated, and this caused a lot of stress, this caused a lot of frustration amongst men, which made them abusive too. Given the pay gap, it is often that women gives up. So men and women are not paid equally. To all those organizations who pay well and who pay equally to all of them, kudos to those organizations. However, majority of the organizations, we see that men and women are not paid equally. So when there was a decision between a husband and a wife, who would leave the job and who would stay back in terms of carrying the household responsibilities forward or being there for the child, it was always the women who had to do the sacrifice. Women have pushed, these factors, they have pushed women to take tough decisions about whether they want to remain in their jobs or leave the workforce altogether. Now, what could be the impact of leaving the workforce? Now, this does not just have an impact individually or per se to a family. This has a global impact. These trends where women are leaving the jobs, if they are left unaddressed for a longer period of time, this will worsen existing inequalities, which will reverse decades of progress. So we will go back 10 years back. Where we are right now, we will go back 10 years back. By stepping off the ladder now, women may not be able to climb as high. If we sit back right now and we do not climb up, we're not going to be reaching up. It's going to take, we will reach up, however, but it's going to take long. It's going to take very long, right? Therefore, do not leave before you actually leave, which means do not mentally leave yourself. If you're sitting at the table at a board meeting, do not mentally take a step back if you're there physically. Be there, be present. Say what you have to, negotiate if you have to, be there. Slow return of women, the gradual return of women will represent lower and less women at the managerial and leadership roles. Already we have a very few people, very few women at the leadership roles, and this trend will affect it more. The global GDP growth could be $1 trillion lower. Again, I'd repeat that. The global GDP growth could be $1 trillion lower in 2030 than it would be if women's unemployment simply tracked that of men in each sector. According to McKinsey and Oxford Economics, estimate that employment for women may not recover pre-pandemic until 2024. Now, what does the return to work look like? 29% of women, they feel that they would never return to work, as far as the survey went in November 2021. Analyzing various surveys conducted with women and employees, some factors can spark women's interest in returning to work. However, there are a few reasons that women would be interested to get back to work. These are some motivations that we could do. So all of those here who have been in organizations, who've been in corporates or who run organizations, these are certain things that could be kept in mind or could be implemented to help the women force back. Flexible working hours, remote working opportunities, just to let them get back to the normal routine, because these 2 years have been a lot. There have been a lot of changes, there have been a lot of things that have gone in terms of their families, in terms of them. So all of that needs to get adjusted. Better pay and benefits, of course, that is what motivates everybody. Career progression opportunities, if there would have been women who've not been promoted since a very long time or their promotion has been pending, do that. If they deserve it, do that. Upskilling opportunities, training, coaching, courses, anything that helps them to get up the ladder, this is the time to promote. Affordable and accessible childcare. This is the far most important thing. If their family is being taken care of, if their child is being taken care of, they'll be more than happy to get on and do all the work that their heart desires to do. Then the transition from new normal to business as usual isn't going to be a walk in the park. If we thought that, we're waiting for offices to reopen, get back, take our bag and go. It's not as easy because everybody has been comfortable now. Maybe sitting in your pajamas, looking at the children in your house and managing the household. I think all women out here, we've mastered the technique of multitasking by now. So kudos to each one of you out here. And many women across the world have been wearing concerns about wanting to go to work, but they are unable to go because of stress and anxiety. Now that they are settled, it is very difficult because the entire system has been in place. Initially, it was difficult to get back to this, and now this transition is going to take time. There are an n number of reasons for this transition or this anxiety or the stress that these women are facing. Men too are facing all of this. However, when we're talking about women, we are stressing here more in terms of how, because there is a lot attached to them, their personal life and their professional life, because everything goes along. Concern about their own physical safety due to COVID. What if I go out and catch COVID? Risk of transmitting COVID to unvaccinated children and loved ones. If I go out, when I come back home, maybe my child gets it, or maybe elders in my family would get it. What would I do now? What would I do then? That feeling of guilt, that fear of losing work-life balance, fear of having a schedule again. Now that everything was going late working hours or early working hours, work being delayed, everything was just at its own pace, getting back to the schedule again. Fear of reduced autonomy and less supportive environments, leaving kids at home. Now, this is what has given rise to another thing called re-entry anxiety. When we're talking about re-entry anxiety, this is what is being commonly spoken about nowadays, where women and others too are feeling stress of getting back to work because they've not met people since a very long time. Opening up, meeting people, going to these social gatherings has become very difficult. And to cope up with this will take a lot of time. And we should partner together. We should help each other. However, all of these were insights as to what has been going around and what could be done. Now, helping you make the process easier, we have a toolkit for you. These are going to be tips, these are going to be techniques, these are going to be all of it that you would need to carry with yourself. If need be, make notes. I would really say make notes here because this is going to help you get back to work. And once you're there, you will remember all of these things because this is what you would need. Right now, we might not feel that there is a sense of anxiety, but once we start walking out, we will have one part of our mind at home thinking about whatever is happening behind, and then one part in office, right? And then that anxiety, that fear, that uncomfortable feeling of what needs to be done and how we're supposed to get over that. Getting on to the toolkit, what is it that we can do to make it easier for us? What are the strategies that probably we can implement to make it easier? Strengths. Nobody has taken your strengths away. Hear me out, you women all out there. Nobody has taken your strengths away. Okay, COVID came in, it impacted, it did, but your career experience remains with you. So get back whatever you thought you were not able to, pick that up again and do it. That is the vital part of your personality. That is what defines who you are. Self-confidence. Carry a positive mindset. Carry an absolutely positive mindset to reconnect with your professional self. Maybe go through those pictures back again, go through those memories back again of being in office, thinking about how things are, only if you choose to. And if you think that this is how it is, it's always going to be a hybrid model where once or twice you might have to go to work, but then too, you'll have to carry yourself up, right? Or make it a journey for yourself. Use positive affirmations. Positive affirmations are very useful in terms of everything that you do or anything that you do. Say good things about yourself, say good things about the surroundings for yourself. Wardrobe makeover. Yes, that's the time. Maybe you can go for shopping. Get a sharp outfit for yourself. This will definitely make you feel more confident. This will make you feel better. This would make you want to go back to work because you would probably want to wear that dress that you bought and meet new people. I already there's a sense of happiness when I'm talking about all of this, right? Maybe we want to go there, but we're not thinking because we're just so comfortable. But this is who we are, right? This is what we need to do. Another part of this is a part of exposure therapy, which we usually do while treating anxiety. Exposure therapy has 4 aspects to this. It says in vivo exposure. imaginary exposure, virtual reality exposure, and graded exposure. So when we talk about these, we mean that in imaginary exposure, we are walking through scenarios and we get into those, we think about those. So we imagine. When we're talking about an imaginary scenario, we go back before we even launch it, before we even go to the main event. We think through and we go in our imagination. For example, in sports, many athletes actually use this technique. Whenever whenever they have a big race, they have to run on the track, they imagine themselves. They imagine themselves running there and winning there. So this is what needs to be done, because that brings in a lot of positivity, that brings in a lot of self-confidence. So try doing that. In vivo exposure is, don't just jump into it right now. What you can do is easily take baby steps, try to identify, try to go back, try to see, if possible, ask your boss or ask your manager or somebody in your office. If the offices are open, if you can just go for a walk, you can just go there. Make yourself comfortable there. Try to make yourself a little at ease, so that, before everybody jumps into office, then there are so many people already, there's social phobia, and there are so many people, you're already in comfort to where you are. Virtual reality, you get those virtual reality headset, wear those, get into your office, see those pictures, feel as if you're at work, if that makes you better. Graded exposure would be gradually taking baby steps. So right now, maybe not just going directly to office, go down, meet a few friends, call some friends for tea, sit together, 2 or 3 colleagues, start working together, and that is how you launch yourself to going to work. Improve your sleeping schedule if you think your sleeping schedule is not in sync with how it should be when you go back to work. Because if you have a family, if you have kids, they will also take time. So at least 1 week prior to your start date, start identifying all of that needs to be in place. Create that schedule for yourself. If you've been having late nights, try to reduce them. If you have kids, try to get them back on the same routine as yours. Normalize and socialize. Start connecting with individuals as much as possible, because we need to really get off that fear. We're living with COVID, and we don't know for how long we'll have to. And we don't want re-entry anxiety to be a part of our lives. Back to the routine. Start getting into the routine. Start your regular work. Journaling, this is one of the most powerful techniques, which helps you emotionally and physically. This is one of the most powerful techniques that many people use, many of my clients use, and they've said that their lives have changed. Do gratitude journaling. When I say that, be grateful for all that you have and all that you're going to be getting. As the more grateful you are, the more at ease you will be, because you're going to be identifying and writing it down for yourself. At least 5 to 10 points in a day. Try to do that. That'll really help. And if you want to know more about it, definitely I'll be here to help you guide as to how you can do it. And it's going to be useful for each one of you. Ask for help. Last but not the least, if you think that all of these, whatever Dr. Anuneet spoke about, Dr. Manushree spoke about, all of these concepts are something that all these causes are something that you've been going through, then definitely do not hesitate to reach out for professional help. Don't come when it's too late, right? So there could be certain things with therapies, with counseling, you can be cured, and with medication, you can certainly be cured. If you have somebody who can help you in terms of your mentor, in terms of somebody who could be your friend, somebody who's your buddy, your partner, somebody whom you can trust, go in and speak to them. Have a coach, have somebody who can help you. And that brings us to the end of this. I will be open to questions, all of us here. Thank you. Just last note from here, take time out and come back to a workplace with a renewed energy. Remember that your time off is an asset, and that during that time you gained a breadth of perspective and many new skills which you can feel proud of. So when a farmer crops his field and there is a time of harvesting, he takes the crops off. There is a time when the land is left barren for the land to regain its nutrients back. Right? Imagine that to be yourself, where you're getting all your energy back and you're all energized. And now when the crops are going to be growing again on that land, which is going to be energized, re-energized and happy, how beautiful is that going to be? Thank you everyone for your time. It was over to you, Adit.
Thank you so much, Nikita. That was really insightful. And thank you, Dr. Manushree and Dr. Anuneet. Who unfortunately had to drop off. He had a patient, so he had to attend to. So we have a few questions from the panel for everyone. So I'm just going to take them up one by one. Firstly, from the audience. One question which was asked by a class 6 student, she was asking that, is it good for me to go on a diet because my friends are doing it? So that one question, we talk about your body self-image and about your peers. So very pertinent question in today's day and age. So how do you feel about that? Dr. Manushree, if you can take that question.
Yeah. So that was what we were talking about. And I think it's a very relevant question, and asked by a class 6 student makes it much more relevant. See, dieting, of course, cannot be recommended to such a young girl. But if she's facing any issues of overweight or obesity, of course, which might lead to endocrinological problems later on, definitely having a healthy diet and a regulated or structured diet would be helpful. But for somebody who has been under peer pressure, the girl has asked that her friends are doing it, and should I do it too? So she is acting due to the peer pressure or the pressure of the group. And certainly, I think we need to have a talk with the parents and the child herself. What is causing this urge to diet? So if there are genuine issues, definitely go. Not due to gaining a certain kind of a body structure or a body weight.
Yeah. So another question we have is from Dr. Sheetal, and that is, what is borderline personality disorder and how can it be treated?
So should I answer, Nikita?
Yeah, both of you can take.
Okay. I think I'll leave the treatment part to Nikita, because I think it has a more, the treatment involves clinical psychologist much more than a psychiatrist. Of course, borderline personality disorder is an exclusive disorder that has been gifted by the gods to the women. One kind of personality disorder that is almost exclusively seen in women. Its opposite is the antisocial personality disorder, which is almost exclusively seen in men. And borderline personality disorder leads to a lot of difficulties in any woman's life. You have to actually appreciate that it's not a very serious or a very core kind of a psychiatric disorder. It's on the borderline between normalcy and becoming psychotic. So the borderline personality disorder has features like, uh, the person has problems with their body image, the self identity. There is a feeling of chronic emptiness within herself. She's not able to form relationships and sustain them. She gets into a relationship, actually idolizes her partner. Then after sometimes there is devaluation. She would say कि मुझे इससे अच्छा हस्बैंड या बॉयफ्रेंड नहीं हो सकता, मेरा हस्बैंड दुनिया में सबसे अच्छा है. थोड़े ही दिन में वो इंसान उसके लिए सबसे बुरा हो जाता है. So that is devaluation. So she has difficulty in relationships. Another important characteristic is the tendency to harm oneself. So we see that such individuals actually come with overdosing of pills, or maybe cutting off the wrist, or cutting cut marks on the wrist or other parts of the body. And they may also attempt much more serious kind of self-harms or suicidal acts. So these are very the emotional dysregulation is also a very important factor. They are not able to control their emotions. And for example, they may react excessively to a minor stimulus or a minor provocation. They might be excessively happy or excessively angry or in a rage for even minor provocations. So this is borderline personality disorder. And Nikita, would you like to comment on the treatment part, please?
Yes. So for this, counseling, pharmacotherapy, along with pharmacotherapy, counseling is advised. Along with that, CBT, which is cognitive behavior therapy, is quite useful, which has showed a lot of impact. While an anger management therapy, wherein because these people, they undergo a lot of issues. They get into a lot of emotional disturbances, unable to identify where they are and where they're going to be. So aggressive comes in, and anger management is also a part there. Thank you.
So coming to the next question, it's by Neeraj Kataria. So they say that 3 years back they suffered from dengue, and after that they observed changes in their food taste, their preferences. So they used to stay away from sour foods, and now they prefer totally opposite. So is it normal for that to happen, and do they require any treatment or anything? Uh, so what are your thoughts on that?
No, I would take over the role of the moderator here and request you to answer this, because I think this is more relevant to your practice, right, Adit?
Yeah. So
Would you
I
like
think
to
we're
answer
in loop now.
yeah. So you're putting me on the spot, but it's okay. So dengue has, from a clinical point of view, there's hardly any correlation, with changing food taste or anything. So they do change, your taste change over a period of time. You get accustomed to certain foods from, childhood, and then when you get into adulthood or you start to grow, you keep on changing, depending on your lifestyle and, trying new experiences. So I don't think it's something that requires any medical assistance per se. It's just a part and parcel of everyday life. Your taste and everything keeps on changing. So I don't think you require any treatment for that.
Yeah. Yeah. So I think this has not been documented that there is a change of taste or food preferences after dengue. But on the contrary, viral infections have been known to cause changes in receptor sensitivity on the tongue and your skin surface. For example, somebody who has suffered from viral infection may suddenly start keeping cold. They may feel cold all the time. So that phenomena is known, but of course, yes, there is no specific treatment, and as Dr. Adit pointed out, and you should enjoy your new food preferences rather than going back to the old.
So we have another question again from the chat, which was that how long does treatment for OCD continue? So does it go away with treatment, or you have to continue it for till the end of life?
See, for OCD is a very complicated and complex disorder to treat. It's one of the most difficult illnesses to treat. But of course, the treatment modalities have been known to be successful. 40 to 50% of all OCD cases undergo some kind of remission, or they are treatment responsive. So I think both pharmacological as well as psychological therapies go hand in hand for OCD. Pharmacology is actually the basic structure or the foundation of the treatment plan, and psychology adds certain value, or maybe it beautifies the whole structure. So
one technique here that I can share in terms of how people can help in terms of OCD. Anybody undergoing OCD, there's a technique called a rubber band technique. In the rubber band technique, you wear a rubber band in your hand, a little loose one, maybe the ones that you get on the mithai ka dabbas, which are loose enough. But when you snap them, it hits. You hurt. You get hurt, right? So wear that in your hand. Every time you have that urge to go wash your hands, or that urge, those compelling thoughts. So OCD has parts, so obsessive and compulsive, which means your physical and your mental body both are not able to come at rest. So either of those, when it happens, pair it up with the rubber band that you have in your hand. Every time you have that thought or that urge to go wash your hands or do something, like maybe check the key, check whether the room is locked, check whether the car is locked, check whether the gas is off, all of this time when you have it, you've checked it once, good enough. You've checked it twice, good enough. However, if you keep on doing that repetitively, you will get a lot tired yourself, right? So this technique actually helps. When you snap it, pair it with another thought. But okay, this is what I'm going to do apart from this. Pair that with another thought. So this is how your mind can be paired. And eventually, those thoughts will tend to subside.
Okay. I think though, another part of the question is how long should you continue treatment? When you start the treatment, at least continue for a year. After at least 1 year, we evaluate what are the benefits and what is still lacking in the treatment. So 1 year is the cutoff time. If the OCD does not remit by then, mostly it's the second step is 5 years, then maybe lifelong. So the first step is 1 year evaluation. We may stop the treatment after 1 year.
We have another question from a student from DAV school. So Rupa, she says that whenever I'm sitting for puja, lunch or dinner, I start to visualize some, garbage piles that I've seen on the side of the road or something. So then I'm not able to eat anything. So every time I start to sit down to eat, I start visualizing those things. So what should I do?
Nikita, maybe would like to answer this?
No, I think you should answer this. This is going to be more in terms of psychiatry.
Yeah, of course. See, these are obsessive images, imagery of images that you do not want to see, but still they are intruding in your thought process. So it's a if this is causing you to not function adequately and it's interfering in your everyday life, of course, you may be diagnosed with the OCD. And for any OCD, the treatment is the same. Uh, you start with pharmacology, that is taking treatment from a psychiatrist along with consultation from a clinical psychologist who can show you the path to various therapies like CBT, cognitive behavioral therapy. She may try to modify your cognitions and how you react to them. So you can meet a clinical psychologist for the same. And if you wish to start pharmacotherapy, you can, on drugs, you may meet a psychiatrist. So the treatment of all OCDs is the same. We cannot give you a pop treatment right now. You should consult your psychiatrist or a psychologist for a comprehensive treatment for the same, because it will get worse if you do not treat it right now. Okay, that is for sure.
So one question, very common, which I think we touched upon, but we did not go into it, is how does one decide when they should seek help in terms of talking to a psychiatrist, a counselor, or a psychologist? So what are the signs that one should look out for before seeking help?
Any disorder becomes a disorder when it starts affecting the normal functioning of your life, right? There are degrees, there are varies that there are levels. Nobody according to psychology is normal. So anybody who thinks I'm normal and perfect, that's a disorder. Right? So nobody according to psychology is normal. There are degrees and it varies for every individual. Once you tend to understand that my life is not going, it's not normal, I'm being distressed, I'm feeling distressed for anything and everything around me, people around me are not happy, there is something which is unusual about me, that is the time when you should actually seek for help. It's not just psychologist or psychiatrist. Go to a friend, go to somebody, not just rely on Google or your researchers, because your researchers can mislead you too, because what you're going to be researching might not be the correct terminology that you're supposed to research upon. Meet your friend, meet somebody whom you can trust, meet a coach if that is something that helps you, then go on to meeting somebody in terms of a psychologist, a psychiatrist, somebody who can help you once you know that this is not being addressed.
One final question. So, Dr. Manushree, you mentioned certain, supplements that one can take, which help relieving symptoms during PMS. Are there any generalized supplements in terms of vitamins or, calcium or some micronutrients that one can take to promote better mental health?
Actually, Adit, there are none. So nobody can recommend a vitamin supplement to take care of your mental health. Similarly, as nobody can recommend to take supplements to take care of your physical health, so you do not fall sick. That is not what supplements do actually. But the only evidence that we have currently is that vitamin D supplementation helps in the treatment of depression. It cannot prevent it, but if somebody has developed depression, it can be helpful along with the therapy and treatment. Vitamin D supplementation. Also, there is some evidence of taking fish oils, omega-3 fatty acids, especially in young adolescents who might be undergoing some kind of mental health issue, who may be confused or who may show some quasi-psychotic symptoms, who are not behaving normally as expected. Then omega-3 fatty acids in adequate dose, not one capsule, not two capsules, almost 3 capsules a day, uh, can actually prevent some of that. But the evidence is not very strong, as I said.
So I think vitamin D is becoming essential. Most of the studies now are coming on vitamin D for diabetes, post-COVID recovery, mental health, like you said. I think, and Indians are one of the largest population that are deficient in vitamin D, despite living in a sun-rich country. But
No,
most
we are
of us are
largest in
deficient.
everything. We
Yeah.
are the largest. You take any statistics, Indians would constitute the largest population
Yes.
because of our overall large population.
Yes, absolutely.
So we are number one in depression. We are number one in diabetes. We are number one in obesity. We are number one in vitamin D deficiency, just because of our population. Of course, diabetes, there are certain other risk factors. Our genetic makeup is such that we are predisposed to diabetes. But yes, the population plays a large part in that.
Yeah. So on that note, I think we'll end the session. Thank you so much, Dr. Manushree. Thank you, Nikita. And if any one of our viewers has any more questions, please feel free to email them to us at feedback@meradoc.com. We'll forward them to the panelists and try to get answers for you. So thank you, Dr. Manushree. Thank you, Nikita.
Thank you.
Thank you, all you.